It is Medical Monday. This time of year, stuffy noses and congestion goes right along with the season, right? But oftentimes, it could be something more than just the common cold. Joining us in studio this morning, we welcome ear, nose, and throat doctor from Genesee ENT Associates, Dr. Kareem Shukairy, to the show. Thanks for being here.
Thanks for having me. Excited to be here.
Yeah, listen, this is the time of year a lot of people dealing with those stuffy noses, trouble breathing through their nose. You know, first off, talk about, though, why nasal breathing is so important to our health.
Yeah, so nasal breathing is extremely important for our overall health. We have structures in our nose actually called turbinates that humidify, filter, and warm the air before it gets to our lungs. And so when there's blockage, we resort to mouth breathing, which can cause a lot of dryness. And at nighttime, this can lead to worse sleep quality, which leads to daytime fatigue, headaches, poor concentration. So overall, nasal breathing is extremely important.
All right, good to keep that in mind. So with that said, what are the most common causes then of chronic nasal congestion or blockage?
So people who suffer from this typically will fall into one of three buckets. Number one, allergies. Very common in Michigan. These can be seasonal or year-round. And this causes swelling inside of the nose, excess mucus production, which can lead to obstruction. Number two is sinus disease. Similarly, sinus disease a lot of times is allergy driven, but not always. This can cause, again, swelling in the nose, mucus production, but it can also lead to infection, which causes a lot of blockage. And number three is a structural or a mechanical issue, so something with the anatomy. And this doesn't necessarily always have to be related to some sort of trauma in the past. Some people are just born with a little bit abnormal anatomy. And so, and oftentimes it's not just one or two of these, it's sometimes a combination.
Okay, so several factors to consider there. So say someone has tried over-the-counter sprays or allergy meds without any relief. What are some of those treatment options that you offer as an ENT specialist?
So as an ENT specialist, first we try to see what they've tried, what's going on. We try to do a thorough evaluation. We're able to look inside of the nose with a camera and kind of pinpoint, make sure we're not missing anything critical, but also see the site of obstruction. And so sometimes we just have to kind of optimize their medical regimen, their nasal sprays. And if we need to order some sort of imaging to help us as well. But ultimately, some people don't get relief with medication. If there's a strong structural abnormality, we can correct with surgery. And oftentimes I think of surgery in this case as minimally invasive for functional reasons because we're able to do it through the nose. We tend to not change the shape of the nose typically, just open it up for breathing purposes.
Okay, bottom line, there are options there.
Yes.
All right, this time of year too, people may be complaining about nosebleeds. Is that related to anything we're talking about today?
Yeah, so in the wintertime, especially in Michigan, we're talking about drier months. And then inside the home, our heating systems also dry out the nose. And so these contribute. The lining of the nose on the inside can get dry and crusty, and that surface can begin to break and uncover some vessels that are very prone to bleeding. And so in general, nosebleeds are not typically very dangerous for most people. They're very treatable, but if it's a recurrent issue, if you find yourself going to the ER, it's probably time to see an ENT. Like I said, most of the time this is very treatable and we can take care of it generally in a few minutes in the office.
Good to know.
Yeah.
And then finally here, you know, we often hear that nasal obstruction can contribute to snoring, sleep apnea. How are those connected?
So people who, again, can't breathe through their nose properly will resort to mouth breathing. And at nighttime, this causes a lot of vibration of the tissue of the upper airway. It can cause some upper airway collapse and exacerbate sleep apnea. So my role as an ENT, typically for patients with sleep apnea that can't tolerate CPAP, we try to figure out if we can make their CPAP more tolerable by fixing their nasal obstruction, or patients who can't tolerate CPAP at all. There are options to help augment their upper airway. There are new technologies such as the Inspire implant, which is designed to keep the upper airway open during sleep. So,
wonderful. Very informative. Thanks for answering our questions this morning.
Thanks for having me.
You'll be in good hands here. Our thanks again, ear, nose, and throat doctor from Genesee ENT Associates, Dr. Kareem Shukairy, for coming on the show.
Thank you very much. Appreciate it.